So in this section, we're going to find out about how to meet your clients for the first time. And this is one of the most important sections, I believe, because as personal trainers, a lot of us haven't had experience in talking to a client. We haven't had the opportunity to develop rapport and trust and really get to understand the anxieties that have been created over the years that have got the client into the gym in the first place. I've had a lot of interns over the years that have come to me to learn things to then hopefully become a personal trainer and work with clients. And the things that I find that they lack the most is that ability to communicate with the client. So doing screening and pre-activity questionnaires is a fantastic way to have a structured approach to finding out about your client and finding out the best way to help them. I was lucky enough when I started my career to be a fitness instructor for a whole year in England, and that enabled me to see 4 or 5 clients a day to conduct tests so I could develop my communication strategies so I can make clients feel more comfortable in the gym environment. So when you start an exercise program, or when a client starts an exercise program, they've come to see you for certain reasons. They're either there because they want to lose weight, they want to gain muscle, they're getting married in 6 months and they need to look good and fit into their wedding dress. There's many reasons. You want to find out exactly why they're there so you can set a specific program to help them. A lot of trainers you'll see in the gym, they give the same program to everyone. That's not really good because every single person comes to see you with an individual reason or a specific reason they're there. So the more information you get about that client and that individual, the more you can individualize the program to meet their needs. So you want to establish their needs and expectations when they first come in. You want to find out about their training history. Have they exercised in the past? Were they an athlete? Say they're an athlete, say they're a football player when they were at college and they did lots of bench press and squats, but they have a lower back problem. But they say, oh, I got to do my bench press and my squats. Well, we need to know this because this has set up their expectations of what an exercise program should look like. So we need to educate them so they can understand, hey, maybe the squats or the bench press is actually exacerbating the problem, and we would then educate them surrounding what might be an appropriate exercise program so we can get them to where they want to be. So knowing where they come from helps us design specific programs and educate them in the areas that they need it the most. We want to understand their cultural and social background. If we're recommending a diet and we're saying you want to eat more chicken and they're a vegetarian, that may not be appropriate. If they come into the gym and there's all these people in scantily clad clothes and they come from a culture that they need to have their legs and arms covered, we need to know this so we do not add to their anxieties and fears walking into this new environment, which is the gym. We need to also understand their physical and mental abilities. If they've been an athlete in the past and you get them down on the floor doing pelvic tilts, they're going to think, hey, this isn't like the sports I used to do in college. Or if their mental abilities, if they learn a certain way, if they're a kinesthetic learner, they like to try things and feel it. If you're busy showing them pictures of what they should be doing, it may not be appropriate. We may want to get them out there on the floor trying the exercises so you start to meet the client where they're at. You want to understand their injury and medical history. For example, if someone has injured their knee and they have anxieties about that knee stopping them run, because when they stop running they think they're going to get overweight, this will help us design specific programs and educate them specifically about their knee and how we're going to design corrective exercise strategies or other strategies to get them back running or onto a different type of equipment so that they can continue to lose weight and get to their goals. Because the clients come to see us because they lack confidence, because first and foremost they lack knowledge. So if we can gain information or insight into the areas they lack knowledge in, then we can build their confidence by providing the education specific to those areas. So we find out a client has had a knee problem in the past, we can then start to educate them about strategies that will help them with their knee and perhaps some other exercise modalities that will get them to where they want to go. Now, this initial screening is all about developing rapport. You want to be friendly and courteous. How many of you out there have gone into like a fancy restaurant and the people have kind of been snobby and they've ushered you through because you haven't been wearing the right clothes or you don't look the part? We do not want to have this set up like this in the gym. We want to make every person feel very special and that they have walked into the place where they are the number one person in our day. And if we aren't friendly and courteous, that they're going to pick up on that and they're not going to feel at home. Those anxieties that they were feeling before they came to the gym are going to be reinforced and they may walk straight out. or they may not listen to you about how you're going to help them and so forth, and they will fail, which is exactly what we don't want. We're all about providing the right atmosphere to help clients succeed. We want to conduct the interview in a suitable environment. Even if you work in a really noisy gym, you need to find an area that is quiet, that you can develop the kind of rapport and communication you need to with each client. Even if you work in a crazy gym, there's no place to go, maybe you meet them in the coffee shop downstairs. If you know, when people go to a nightclub and they head straight to the bar, it's because they're anxious seeing all these people out there who look like they know what they're doing, they're dancing around, all looking good. They go to the bar because it's a quiet environment and they know what to do. They know how to buy a drink, they're talking one-on-one with the bartender. So this is what we need to do when we first see a client, is create a personal space that we can listen attentively to our clients and develop the type of atmosphere that will make them feel most comfortable. Provide them with written policies and procedures. This helps you feel safer because, first of all, there's a strategy in place that you can follow, but it's also going to make them feel more comfortable because they understand, oh, there is a certain way they do things. They're not just flying by the seat of their pants, and they will feel safer in your presence. Explain your position and experience. If you are a gym instructor that does fitness testing, tell them that's exactly what you do. It doesn't make you look weaker. It actually establishes you as an expert in that area. So next time they need to come back for a retest, they're going to come see you. Then next time that they come back, maybe 3 months later, you may have gained further education, which is great because you can say, oh, you've improved, Mrs. Smith, but you know what, I can help you get even quicker to your goals. May I show you some new strategies that may help you get to where you want to go? So during the client orientation, you're going to collect all the relevant information, such as their lifestyle, their exercise history, their strengths and weaknesses, their goals. People always like to focus, the clients like to focus on their weaknesses. What I like to do is ask a client, have you tried say they come in to lose 20 pounds, you say, have you tried to lose weight in the past? Yes, I have. Well, how did you do out of 10? Give yourself a rating out of 10. Well, I probably got a 6. And they think that a 6 is not that good out of 10. Well, you say to them, well, why wasn't it a 5? I don't know, I went to the gym a couple of times a week. Now you can focus on their strengths, which is, that's fantastic you got to the gym a couple of times a week. We can build on that because you've already developed the discipline to get to the gym, and we can use that, Mrs. Smith, to help you build upon your program. Now you're focusing on the things that they have done versus the things they haven't done. Now they know what steps they need to take, which is go to the gym, and with your help with the right program, they already have the steps in place. With your help, they will then get to their goals. So focus on the person's strengths, which is a positive strategy, which also builds their confidence, which is of utmost importance. Conduct the health screening questionnaires, and this will help you understand if do you need to refer out. When I'm training people and interns and so forth, they always say to me, Justin, how do I get clients? How do I get clients? Well, the best marketing thing I can suggest is get referrals. It helps you develop networks. If a client comes to you and they say, oh, I went to see my doctor, Dr. Brown the other day, I say, oh, Dr. Brown, where's he? What does he do? Oh, he's my cardiologist. Great, would you mind if I give Dr. Brown a call and tell him about our sessions together and see if there's anything I can do that he can guide me to help you with your program. You just developed a network because you have an in now with Dr. Brown because the client, or you, the client that I'm seeing, got me in with Dr. Brown. So now if I approach Dr. Brown in a professional manner, he now sees that I'm interested in your progress. I now have Dr. Brown possibly referring to me other clients because I've approached him in a professional manner and I actually care about his clients getting better and getting to their goals. So actually referring out is not a bad thing. It doesn't say, I don't know what I'm doing. It actually helps you get clients, so it's fantastic. You want to conduct the fitness assessment next. So obviously the fitness assessments that make sense to the client. If you get an older client coming in and they want to get more flexible because they can't touch their toes, they can't put on their shoes in the morning, they have to use a long shoehorn, then doing a push-up test may not be appropriate. Maybe a sit and reach test is appropriate, or even something as simple as, well, let's see how close you can get to touching your toes. So make the fitness assessments as you gain insight into what fitness tests there are available, to make them appropriate and person-specific, because then the person will see the reason why you're doing them, and it'll also help you with program design in the future. Then you'll design and prescribe the program, always being specific to the client, making sure that it is in line with their goals, not some just regular routine that you did with someone else. I like to, when I'm going around gyms, walk up to the trainer who's working with a client, and a lot of people say to the trainer, why are you giving this client this exercise? I think a better approach is to ask the client, hey, why are you doing this exercise? Because then if the client knows why they're doing this exercise, the trainer has educated that client into why this exercise is particular for helping them reach their goals, and the client is actually involved in the process, so they'll be empowered to be part of the process, which will ensure they get to where they need to go. Client obviously conducts the program on their own or with the help of a personal trainer, and then the most important part is the regular review, retesting, progression, and adjustment. If a client can come in and you can give the opportunity to say, great, you're doing the right things, it actually tells them the behaviors that they are doing that are helping them be successful. A client will come in to my facility and we will always review first so that I can start the session with a positive approach saying, that's great how you did that, that's great how you did that, this is good, we may need to work on this, this, and this, which gives them those behaviors they need to do to be successful next time. But we start on a positive note so that we're always identifying those behaviors that they've done correctly to get towards their goal. So you're going to have the opportunity to do the face-to-face interview, but I think before you even see the person face-to-face, if you have the opportunity to talk to them on the telephone, it's fantastic. Or even if it's just an email to help set up what they're going to expect, because they're going to be very fearful first arriving in the gym. We went to Africa last year, and my good friend kept calling us and sending us emails telling us about, oh, don't worry, Justin, there's this black mamba in the office, and the black mamba's this 7-foot snake, and means you've only got 7 feet before you drop dead. And then we finally got to Africa, and when we left the airport, we're driving down this road, and he goes, oh, Justin, you know this road's in the Guinness Book of World Records as the road where there's the most deaths anywhere else in the world. And we're looking down on the ravines, and the bushes are actually on fire, because in Africa, if something catches on fire, there's no local fireplace to come and put it out. And they're on fire because trucks have actually crashed down. There's oil tankers, and this is gospel truth, I promise you. There's oil tankers down in the ravines on both sides. We continue down following the road until we get to the river, where we're going to cross the river to then continue to the lodge. When we get to the river, my friend Steve says, hey, we're going to get in the boat and head upriver to the lodge. Well, before we've left America, we've been told that if any water from the rivers or lakes touches your skin in Africa, there's a little microscopic organism that can actually dig in and eat in your kidneys and you'll die. So obviously our anxiety is increasing all the time. We continue down the river. As we get to where the river turns into a big, it widens, there's a whole bunch of hippos. Just before we get there, Steve, our friend, has been telling us, don't worry about the hippos. They kill lots of people on the river every year. Just yesterday I was out with a group of people. A big hippo bit the bottom of the canoe. I went flying up in the air. But don't worry, Priice, you'll be fine, don't worry. So obviously our anxiety is increasing. Our anxiety is increasing. And you're thinking, why is he telling me this story? Well, this is all the experiences that client is going to have coming into the gym. They've had their girlfriend telling them about, oh, I went to this one trainer and we did these exercises and I couldn't walk for a week. They got their mother-in-law telling them about, oh, I had to do this stress test and they put the thing up so high, I fell backwards off the treadmill. What you want to do is call them, alleviate their anxieties by educating them. You're going to come in, Mrs. Brown, and what we're going to do is go through some very simple tests. You'll need to wear running shoes at any time during the testing. If you don't feel comfortable, we can stop it. Don't worry about anything. I will make sure you feel comfortable. It's going to be tailored to you. So if at any time there's any problems, we will just finish the testing and we conduct it some other time. So we need to make sure we decrease people's anxieties, not increase people's anxieties, because otherwise they would have failed before they even get in the gym door. So then when you get to the face-to-face interview, you're going to be professional, appropriate, attentive, and friendly. It's the same thing I was talking about going into the snobby restaurant. You want to make them feel comfortable, so meet the person where they're at. Use the appropriate language for the situation. Make sure you're dressed appropriately so that you can be watching, listening, and paying attention to that person. You're not wearing some buff piece of clothing, checking your own abdominals out in the mirror. It's all about that person. Consider how they're feeling, which is they're scared. They're absolutely petrified, otherwise they wouldn't be there in the first place. Have they trialed and failed before? Because if they've failed before, they're even more scared because they're thinking, that last time I was in the gym or tried an exercise program, it did well for a while, but I failed, so I'm a failure. So we need to be aware of these things before we get involved in the exercise program, because each part of the program, you need to make sure your client is successful at that step so they will gain confidence to get to the next step. Ask them why they failed so you can start to help to identify their anxieties and those behaviors that were either successful or not successful or might have been counterproductive. And make sure you listen to them. My wife is always telling me, Justin, you need to listen more. And I think I'm listening all the time. But as trainers, we come in and we go, I'm going to help you this way. Well, that develops you as the authority, doesn't it? Do what I tell you to do and you'll get where you need to go. That's not the type of relationship you want to set up. You want to set up a relationship where the client takes responsibility. And the only way you're going to do that is actually listen to them, find out their anxieties, find out about their lifestyle, so you can design a program that will facilitate a change in their lifestyle to get to their goals. Now, the pre-activity screening is obviously your pre-activity questionnaires. Now, people tend to rush through these things. Yeah, blood pressure, medications. Make sure this is your time to develop rapport. This is a structured approach to developing trust and a relationship with that client. And this will help you find out about their anxieties. If they're crossing their legs when you're asking them about their blood pressure, or they're looking up, checking their phone when you're asking them about their weight, this indicates that they're very anxious about those things. And you can make little notes or checks by those things because this is their underlying motivations as far as why they're there. And this is what you need to know because that's the ultimate reason of why they need your help. Past training records will also help indicate whether they have succeeded or failed and why. Medical records, if you can get their medical records, this also gives you the opportunity to network with other professionals, which helps establish you as a professional, which obviously then gets you client referrals from those medical professionals. That's the same as liaising with other healthcare professionals, and always ensure the confidentiality of the client information. This protects you and it protects them. Don't assume anything. A client is going to always worry in the back of their mind, well, I better not tell this trainer, that's just a trainer at the gym. If you tell them that everything that they say and do with you is confidential, that reassures them, it helps build trust, and they will feel more confident in your presence. And if you do not feel confident asking any of these questions, and you don't feel confident doing the testing, refer out. It is always better to refer out, because if someone comes in and they've got 2 risk factors for not participating in an exercise program or even the screening, don't put them into the exercise screening, because if they go into the exercise screening and fail, say they're on the treadmill and they can't keep up with the level 2 you've got them, they now failed. So if you refer out, they can be successful at that step, which is I can go to the doctor, I can get my clearance, come back, oh, I see that you've got these risk factors. You can then design a screening and exercise testing that is appropriate for their level, so they can be successful each step to get to the next step, which will build their confidence so they will continue in the gym environment, which means you'll have more clients and they'll be more successful. So the screening forms are issued prior to the delivery of the fitness assessment. This helps tell you where the client is at, so you can develop the exercise strategies that will get them to the next step, and enables you to give them the exercise strategies that they can be successful at. A lot of my clients, I'll have them foam roll as a form of self-myofascial release. Now, if I see a client go to get on the foam roller and they can't get down there, I'm not going to start pushing them down, just get down there, what are you doing? I'll develop another strategy that they can be successful at, which may be to lie on a massage table or the bed with a tennis ball under their hips if we're trying to release the tissues of their hips. I'm not going to force them to do something that they feel uncomfortable at, because they're thinking in the back of their mind, I'm such an idiot, I'm so useless, I can't even get onto the ground. If you see this and get to it before they develop that anxiety, you're going to give them something that they can be successful at. So that's the same reason why you have these screening forms, because it helps you understand where your client is at. All these things are reviewed by fitness professionals before any testing. Contradictions to exercise should initiate a referral process, so that if you see that a client has a risk factor, then you would refer out. And like I said, that referral is not a bad thing. It's going to help develop you as a professional in the long term. So the lifestyle questionnaire helps establish current and previous activity levels. And this is very important, because when you understand your client's exercise habits and their activity habits, you're now getting to know their life, which is great. Because let's say, for example, they travel, and you're giving them an exercise program that involves certain pieces of equipment that are only found in specific gyms. Wouldn't it have been nice to have known that they travel 3 days a week, so that your exercise program that you design for them can take that into consideration? Because if it does, knowing that will make sure that you can provide exercises while they travel, and they can be successful given their lifestyle habits. You'll also find out about their stress levels, their smoking level, if they smoke, if they drink. Depending on the club you're at, you may be finding out about their nutritional habits. And let's just go back to the stress. Stress is so important. If a client comes into you and they're stressed like this, are you going to suddenly go, yeah, well, we're going to do the bench press test now? Well, no, because obviously the stress is going to create a physical manifestation, which is a kyphotic posture. And just by asking them, hey, how was your day, Mrs. Smith? They're actually going to unload this. So they're actually, by dealing with their psychological issues, you're going to help their physiology, which is going to get them in a better place to begin the exercise testing, which is where you want to do, because then they'll be more successful when you get to the exercise testing. The medical and family history, which is your Part Q, will establish if medical clearances were required, which you'll refer out for. A list of medications. Now this may seem like a boring piece of information, finding out about their medications, but when you find out about their medications, you find out about their anxieties. If they're taking a medication for blood sugar, then possibility that they might have type 2 diabetes. This is obviously a very fearful situation for people, but the great thing is that exercise helps people with diabetes. It increases your insulin response. So if you can find out about the medications, you can find out about their anxieties, which tells you specifically where they need education, which is, did you know that by doing exercise, this increases the insulin sensitivity of your muscles, which will actually help decrease your blood glucose, which will help you. Now all of a sudden your education is helping them with their anxieties. So finding out about their medications is not boring at all. It actually tells you why they're there to see you in the first place. So get informed consent from the client, and advise clients on the risks and benefits of an exercise program. And this is fantastic, because people will see that the benefits of exercise will actually help them with the things that they have anxiety about. Other relevant questionnaires, such as nutritional analysis, may be appropriate depending on the gym and club that you're working at. So the cardiovascular risk stratification tells us those clients that are at risk for cardiovascular problems if we were to continue with the exercise testing. And this is important, because this helps you profile those clients, which helps you decrease your anxiety. So if you see clients that have some of these risk factors, you'll know what to do and what to look out for, which is great, because when you have less anxiety, then your confidence increases, and that comes across to the client, and their confidence will increase in you and the program, which is what we want. So those clients that are at low risk would be men who are under 45, women who are under 55, and who are asymptomatic and have no more than one risk factor. And we'll go into the risk factors in the next slide. So those that would be at moderate risk would be men over 45, women over 55, or those that have 2 or more risk factors. High risk would be those clients that have signs and symptoms of cardiopulmonary disease or known cardiovascular disease, known pulmonary disease such as chronic obstructive pulmonary disease or COPD, asthma, lung disease or cystic fibrosis, or known metabolic disease such as diabetes, type 1 and 2, thyroid disorders, renal disease, which is kidney disease, or liver disease. And this is important to go through these things. Although this sounds like boring information, it actually helps you develop the communication you need with your client. Because if someone has liver disease, they're going to feel very, very anxious about this. And if you can actually gain information about that, then you can go away and educate yourself about liver disease so that you have a point of interest to come back to and educate your client about. So here's the cardiovascular risk stratification as defined by ACSM, which is the American College of Sports Medicine. So finding out about someone's family history is very important. Heart attack or sudden death in the family before 55 in a father, brother, or son is considered a risk factor, or 65 in a mother, sister, or daughter. So if a mother, sister, or daughter has died of a heart attack before the age of 65. Systolic blood pressure at or above 140, so systolic is the top number on the blood pressure, or diastolic at or above 90. So 140 over 90 would obviously indicate hypertension, and this would be measured on 2 separate occasions, or alternatively if they're on blood medication, which would obviously be for that reason to control the hypertension. High cholesterol, so LDL, which is your bad cholesterol, if that's greater than 3.4 millimoles per litre. If that's not available, then looking at total cholesterol being greater than 5.2 millimoles per litre. Or if HDL, which is your good cholesterol, if that's less than 0.9 millimoles, that's also considered a risk factor. Or obviously if they're on cholesterol lowering medication. High glucose, if their fasting blood glucose is greater than 6.1 millimoles per litre on 2 separate occasions. If their BMI is greater than 30, or their waist girth is greater than 100 centimetres, and 100 centimetres is about 45 inches, depending on the country and the measurements you're using. If they're sedentary, does not participate in regular exercise or meet the minimum standard government guidelines. Current smoker or has quit within the last 6 months. And a positive risk factor, meaning this can actually help delete one of those risk factors, would be if their good cholesterol, so their HDL, is greater than 1.6 millimoles per litre. So that's considered a negative risk factor. Now, if you can start to be able to identify those people that fall into these risk factors, it helps you alleviate your issues about, oh, what am I supposed to do with this client? Because if they fall into these risk factors, you're going to approach them in a different way and develop an exercise program they can be successful at. You're not going to say, well, I know you want to get into that wedding dress in 6 months, so we'll probably get you running 2 or 3 miles a day. Well, if that person runs 2 or 3 miles a day, they may have a heart attack. So this is obviously good information to know, because if they have a heart attack, they fail at their program and you lose a client. So it's very important to know this so you can design exercise strategies appropriately. Your absolute contraindications to exercise testing, therefore, would be a recent heart attack or myocardial infarction, a recent change in resting ECG suggesting lack of blood supply to the heart, which is a significant ischemia, chest pains or unstable angina, acute congestive heart failure. And just as we go on, remember, you're not going to need to know all these off by heart. The client is going to know if they've had these because a doctor would have told them. They're not going to suddenly think, yeah, perhaps I do have congestive heart failure. They would have seen a doctor in the past and know to answer yes or no to these questions. An uncontrolled heartbeat, which is cardiac arrhythmia, narrowing of the aortic valve, severe symptomatic aortic stenosis is what that is. Suspected or known weakening of the artery wall, which is an aneurysm. Suspected or known disease of the heart tissue, which is myocarditis or pericarditis. Recent systemic blockage of the pulmonary artery, which is known as a pulmonary embolus. Acute infection such as hepatitis. Someone's recovering from hepatitis, you don't want to suddenly throw them into a stress test or a push-up test because obviously their immune system is going to be weakened. And significant emotional stress, more than just walking into the gym. We're talking about psychosis, such as a nervous breakdown. If someone's recovering from a nervous breakdown, obviously their nervous system is going to be recovering, and we don't want to add more neuromuscular stress to that, because obviously something might happen and they will be a failure at the exercise testing. So that's a contraindication to continuing with exercise testing. So having said all that about all these risks, there aren't the risks associated with testing aren't that high. They're generally minimal. The risk of death during or after an exercise test is less than 0.01, which is about 1 in 10,000. And especially if you're aware of the risks, you can minimize that even greater. The risk of heart attack during exercise testing is less than 0.04, and a risk or a complication as a result of the test that will require hospitalization is about 0.2%, and that statistic comes from ACSM again. Most of these risks should be eliminated by pre-screening. So screening needs to be properly conducted, so follow the guidelines that we've set out for you. And understand that clients may or may not tell the truth. They're not trying to lie to you, just most of them really don't care as much as we do as personal trainers. As personal trainers, we're very particular about our diet and when we exercise. Most clients don't have this kind of anal approach to exercise because otherwise they wouldn't be there in the first place. So maybe you get them to take a food journal or an exercise journal, which will help them with recall. But understand that they're not trying to lie to you, they just really haven't thought about it as much as you have. And maybe you give them an opportunity, if you're screening them at the beginning before you do the actual physical tests, tell them, hey, if you can't remember everything now, as we continue with the exercise testing, just let me know if there's anything else that you think will be pertinent to me gathering information as we continue through the exercise today. And then that gives them an opportunity to give you that information so they don't think, oh, I hope I didn't forget anything. Enforce the medical approval requirements. So if you need to refer out and they need to get clearance from a doctor, that's very important. Most gyms have exercise testing policies, which is important, and if your gym does, make sure you follow them, because that obviously will decrease your liability, which is very important. What are the emergency procedures? This is very important because it helps protect you, and it also shows the client that you're working for a professional, reputable gym. And have you practiced them? I was actually working in a gym with a client, and another trainer was running around the gym screaming, help me, help me. What had happened was he'd actually had a client doing a behind-the-neck military press with a barbell, and the client, blood supply cut off to the brain, the client actually passed out. So I went over and revived the client. Sounds kind of weird, but all I did was actually lift him up by his feet so blood could get to the brain. But the trainer didn't know what to do. So obviously when the client then came out of hospital, because he went to the hospital to make sure he wasn't going to die, which is obviously a great idea, the client discontinued seeing the trainer, and I'm sure over time discontinued or had a lot of fear about exercise, because obviously it is very fearful to pass out during exercise. So it's very important to know what to do if an emergency happens, and specifically how to address it so that you can make the client feel safe so they do not discontinue with exercise. For the fitness assessment preparation, this is where a phone call or an email is great, because it's going to help the client feel prepared when they come in to see you. Because you can tell them of the duration, Mrs. Jones, you're going to expect to be here for an hour, if there's any cost, the content, because they're thinking, what do you do when you go for a fitness assessment? Am I going to have to run around the block? Am I going to have to do 1 million push-ups and sit-ups? You're going to tell them specifically what's going to go on. But obviously you also want to keep it simple. You're not going to go through everything saying, well, first we're going to ask your blood pressure and then your blood glucose, and then we're going to do a push-up test. We're going to see how many push-ups you can do. But don't worry, I'm going to be there motivating you and you're going to be really good at it. But then we're going to do some sit-ups and we might do some flexibility testing. They're freaking out, right? So when you do call them and inform them of what's going to happen during the exercise testing, keep it simple. I like the KISS, which is keep it simple, stupid, because then that alleviates their anxieties about coming to the gym in the first place. Now in this call or email, make sure you tell them about their clothing considerations. If you're going to be looking at their knees or assessing their foot and ankle, to see what their foot does, say on the treadmill, you may be asking them to wear shorts. And I can guarantee a female, if you say, hey, can you just go put on these shorts in the changing room, and they haven't shaved their legs for a couple of days, are going to freak out. So they need to know these things before they get there, which is going to make them feel more comfortable in that environment. They want to avoid strenuous activity before they come in to see you, so they don't want to be running 6 miles into the gym. Okay, great, I'm ready for my exercise testing, because that's going to obviously make the tests invalid. They want to avoid caffeine, which is going to probably increase their heart rate, tobacco, or food for about 2 hours prior to the exercise testing, because that's going to affect the results as well. No alcohol within 12 hours. In England, I worked for a chain of gyms that was in the city, where in England, people tend to go out for a pint every day at lunch. So I had a lot of clients coming in after lunch who had had 2 or 3 pints, and they used to get very upset with me at the beginning, saying, "Oh, I'm sorry, we can't actually exercise today," or "We couldn't do the exercise testing because you've had a couple of pints." But after a while, they actually realize that I care about them and I don't want them to pass out, and it develops me as a professional. So this is actually very important, and it's good for your clients to know as well because it keeps them safe. And now ideally you want to be in a relaxed state, because we want to obviously get baseline measures. Caffeine's obviously going to increase their heart rate, which is also going to stress them out slightly. The nervous system's going to be heightened, possibly if they've come from a meeting. So maybe when they first come to the gym, you're going to sit them down, ask them about their day, and try to relax them before we get into the exercise testing. So you want to make sure the tests you use are valid. So are they measuring what they're supposed to measure? And your gym would hopefully have chosen those tests that actually have good validity. And if they haven't, maybe you can research and then find tests that have better validity. They also want to be reliable, so they want to be consistent from test to retest. And this is why it's great if you are a fitness instructor and you become very good at doing certain fitness tests, you can make sure that the parameters are the same each time you perform the fitness test. So if you're doing an ergo test and the first ergo test you do is on this old bike where it's just not quite going, and the next time you got some new bikes and they're in the spin room and the music's blaring and you're doing it with a guy and there's this hot girl in front, he's probably going to perform better in the second test, don't you think? So it's good to know these retest reliability. Otherwise, this guy's going to think, oh, maybe it was beneficial that I sit on my butt all day long because I seem to get better at that test. So performing the test the same each time will make sure it's reliable and you get consistent results. So the tests want to have specificity and relevance to the client's goals. If you have a choice on the exercise tests you use, make sure they're relevant to what the client wants to specifically achieve. For example, if that older client that we're talking about that couldn't touch their toes, it would probably be a better idea to give them a sit and reach test than a push-up endurance test, because obviously they will see the relevance in trying to see how close they can get to touching their toes. You want to understand the client's injuries. Obviously, if they have a knee injury that is aggravated when they bike ride, you don't want to give them an ergo test. Understand the client's goals. Obviously, if their goal is to be able to run a marathon, it may be a good idea to give them a running test or a treadmill test, because this has relevance and also is applicable towards them reaching their goals. Understand the client's preferences. If you got to give them an ergo test and they say, "I hate riding a bike," then it may not be a good idea, because they're not going to perform well on that test and they're not going to come back for retesting, and that won't give you the opportunity to educate them further and help identify what strategies they've done to be successful, because they hated the test in the first place. So give them the opportunity to choose their tests and try to get something that they like, so there's going to be a more likelihood of retest, and there's going to be more likelihood that they're going to come back to see you. Be sensitive. Obviously, a skin fold test may not be applicable for everyone, so maybe a circumference test may be more appropriate, so that you can just gain a baseline. Some people don't even want to have a tape measure, because if you see on a tape measure, oh, my girth is 50 centimeters or 60 centimeters, why don't you just get a piece of string, tie it around and see that where that piece of string is? Because that now is a test, isn't it? It creates a baseline, so when the person goes through the exercise and nutritional changes, they can come back, place the string around and see that their girth has decreased. They don't need to know that they are obese and their girth is 60 centimeters, do they? It would be nice to just get that baseline so they can come back and retest. So be sensitive and use tests that are appropriate to that individual. And retesting, make sure that you have the same tests and conditions for the retest. Obviously, if you use a scale the first time, don't go and use calipers, skin calipers the next time. If you do the first test in the morning after coffee and they suddenly do really well on the ergo test, don't do it after they've been on a boys' drinking weekend and they come in really tired and hungover. You want to make sure that the retest considerations are exactly the same. So the test or assessment order can have a huge bearing on the results. You want to begin with the passive tests before the active tests. So if the client comes in stressed, get them into a relaxed state, and then take their heart rate, blood pressure, and blood profiles, because some gyms will take blood profiles. If they come in, in England, I know a lot of my clients would be late because the tube is late pretty much all the time in England. So they'd be running there, and I wouldn't obviously then take their blood pressure because it's going to give us a bad reading. So we would start relaxing, finding out about how they went the day before, and then take their resting measurements. And then we're going to take their anthropometric tests, which are their body composition, their girth measurements, etc. Then go into the posture. Maybe you do your static postural assessments and then into your more dynamic postural assessments. Then you'll do a warm-up, followed by their cardiovascular assessments. Obviously, a warm-up helps increase blood supply to the heart and obviously prime the nervous system so it's ready for the cardiovascular assessment so that the test is actually going to be valid. So then you're going to do your muscular assessments, which are obviously going to be on another day if you can. You'll do your strength tests first, which would be like your 1 rep max tests, which I know some people still use out there. And then your endurance tests, such as your push-up tests, your sit-up tests, and so forth, will come after the strength tests. Flexibility tests next, whatever you deem appropriate for that client or whatever you use that is specific to your gym and the client's goals. And then cool down and stretch. And then the most important part is the explanation of the results. A lot of people like to test, or a lot of trainers like to test to then show clients where they are in relation to someone else. I don't think this is a good idea because it develops an extrinsic motivation. It tells people, I want to get better so I can be better than Johnny over there. Or I want to do this because, you know, my friend Jim was this good, I'm this good, I want to get better than Jim. This develops an extrinsic motivation, which is an external motivation, and that is short-lived because what happens when they suddenly get better than Jim? Where is the motivation now? So if we can develop motivation from within, meaning we explain their results like this is where you're at currently, this is where you want to get to for your goal, and then develop patterns and strategies that build on where they started so that we can see improvements for them. Because then we can shift the goal all the time because they are in charge of setting the goal, and then we develop more and more intrinsic motivation so they can be motivated from within versus without. Because if they're motivated from without, it won't continue and they'll fail and you won't have them continue as a client. So you'll obviously stop the test when they've attained the desired performance. Say you've done the test for the specific time or you've followed the parameters to show this is what the test results you need. And you'll also stop the test if a client complains of dizziness, so that's not a good idea. If they're exhausted, if they say I need to stop for some reason because they feel anxious having their heart rate up there, or they feel like they're going to fall off the treadmill. If there's a drop in the systolic blood pressure of more than 10 millimeters from the baseline, because a lot of gyms will actually have the blood pressure being taken while they are testing. If there's loss of color, I like to use, if a client is exercising and we see the tips of their ears go white, that means they're starting to lose blood because you'll actually lose blood from the periphery first if you're having problems actually supplying blood supply out to the organs. So you'll actually start to, out to the periphery. You'll actually start to restrict it towards your center. So the first thing you'll see is actually just the tops of their ears go a little bit white. So if you see that, you need to actually terminate the test because there's going to be a problem if you continue. Any form of angina, which is chest pains, and obviously if there's equipment failure. I suggest that what you do when you start working in a gym, any time you have, is go around and familiarize yourself with every piece of equipment. There's so many times I've seen trainers get a client on a treadmill and they'll be like, how do you start this thing? You keep walking, we'll just press quick start, and they don't know how to use your piece of equipment. How do you think this looks to the client? Or they don't know how to make sure that the straps on the bicycle actually stay on. So the person's pedaling and they're going really hard and they've been doing their ergo test and they're hoping to get to the next level and the thing comes flying off and they're exhausted, been doing it for 8 minutes, and you as a trainer go, we'll just have to do that one again. It's not too good. So if there's obviously an equipment failure, you want to stop. But this just highlights the point that if you're in a gym, you need to familiarize yourself with every single thing in that gym so that you can make the client feel comfortable and confident, because that's the most important thing when they come to see you, is develop rapport, make the client feel comfortable, confident, and educate them towards the goals that they want to achieve so they can be successful.